My name's David. If you're planning to travel to an Asian country in the Western Pacific, you should know about the Japanese encephalitis virus, or JV. JV is a single-stranded RNA virus, which means of its DNA being a double helix, it's a single strand. That means it needs a host to reproduce. JV is part of the flavivirus genus. The flavivirus genus is part of the flaviviridae family. Where am I? This family contains over 70 different viruses. Some of these viruses are JV, dengue, St. Louis encephalitis, and yellow fever. These 70 viruses have three main groups: mosquito-borne flavivirus, tick-borne flavivirus, and unidentified borne flavivirus. JV is found in Eastern, Southeastern, and Southern Asia, as well as Australia. So countries like India, China, Thailand, Taiwan, Korea, and of course Japan. JV is spread by mosquitoes. A culex, which is a gene of a mosquito, more particularly the culex Tritinorhinoculatus.
Tritinorhinchus.
The virus is cycled from pigs and wading birds such as hares and egrets. The pigs and egrets we see in these animals because these animals have a high viral load. Viral loads is the amount of viruses in one body, meaning these animals have a high virus percentage. Humans are end hosts. This means that we do not produce enough viral loads for a mosquito to bite us and transmit it to something else. So a mosquito can't bite someone with Japanese encephalitis and they give it to my dog Vader because we are end hosts. Okay. The initial symptoms of JV is a fever, headache, and vomiting. Over the next few days, you may experience some disorientation, you may feel weak, and you might slip into a coma. Seizures are also common, especially for children. Where am I? However, most people do not experience symptoms. 99% of the people with JV do not experience a symptom. Less than 1% of the people with JV develop neurological illness. Among that 1%, only 1 and 1/4 die. That is about 20 to 30% of people. There are three stages of JV. The first stage of JV is called the acute stage. In this stage, the central nervous system sees degeneration. This is inflammation in the brainstem that disrupts the connection to the nerve endings. And in the acute stage, there are also congestion, hemorrhages, and thrombus formation. Hemorrhages are bleeding episodes that occur because of vessel damage. These JV hemorrhages occur in the brain. These hemorrhages happen because of thrombus formation. Thrombus formation is the scientific term for blood clotting. Pretty sure, don't fact check me. The blood clots in the brain, disrupting blood flow. This damages the vessels and causes hemorrhages. These changes are mainly viewed in the gray matter of the brain. The gray matter of the brain are the gray spots shown in a CT scan. A CT scan is like when the doctors go over your brain and you see your brain. There are also lesions that are found in the diencephalon and the menincephalon, as well as the brains and the brainstem. The diencephalon is a relay center for sensory information. It takes the input of the sensory information and relays it to the menincephalon. The menincephalon regulates motor and sensory information and is located in the central part of the brainstem. These two spots are where the main lesions are found, but there are also lesions found in the brainstem, cerebral cortex, and the cerebellum. The brainstem's main job is breathing, heart rate, and blood pressure. The cerebral cortex's job is thinking, memory, and language. The cerebellum's job is coordinating movement. It maintains our balance. Yeah.
Cerebellum.
I knew that. I was testing you guys, actually. The cerebellum's job is coordinating movement. It maintains our balance, and it controls our muscle tone. These brain lesions disrupt normal brain functions.
Is it?
Yep. Don't question me. Don't question me. The second stage of JV is the subacute stage. In this stage, inflammation and circulatory differences are fewer than in the acute stage. However, degeneration and nerve cell damage become more pronounced. Most of the inflammation is found in the previously stated diencephalon, menincephalon, and the brainstem. It is found in the cerebral cortex, cerebellum.
I might have been wrong.
Spinal cord, and the meninge.
Meninges. The
meanings are layers that protect the brain and spinal cord. In the third stage, it's called the chronic stage, there is now degeneration or disappearance of the nervous tissue. There is also fibrous thickening in the vascular walls. Something else to add that happens in the mesencephalon brainstem, but also especially in the substantia nigra, is necrosis or softening. Necrosis is death of body tissues, meaning that those parts of your brain slowly die, which kills you. However, getting to the third stage is actually very rare. Like I said earlier, only 1 in 4 people die. Your JV has a vaccine named ECRO. This vaccine is available in the USA and is approved for adults and children 2 months and older. If you're having an extended stay in Asia or Australia, it is highly advised to get vaccinated. Another way to avoid JV is to avoid mosquito bites. Use EPA-registered insect repellent. You can find EPA repellent spray in retailers such as Amazon and Walmart. Check the can for the EPA seal, or check in the retailer's description stating it's EPA registered. Another way to prevent mosquito bites is to wear long sleeve shirt and pants. Another way to prevent mosquito bites is to add 0.5% permethrin to clothing. However, keep in mind that if used incorrectly, permethrin can be dangerous. Permethrin can be dangerous, which it can be dangerous, okay? When you order a hotel, get one with a window and door screens. And if you're camping, always use a protective net. And always make sure to review the country's specific recommendations and health notices and warnings. Here's a brief history. This is my last part. Brief history of JAV. JAV was known as a Yoshiwara Code in 1904. This was because the doctors didn't really know what JAV was and they thought it was a normal cold. There was also following epidemics of JV in 1924, 1935, and 1948. Up to and after the 1924 outbreak, pathologists were interested in the lesions of the central nervous system. And in 1933, the Committee for Epidemic Encephalitis was established by the Japanese Association for Scientific Advancement. Animal test subjects really helped us understand lesions that pathologists were once curious about. After 1938, After 1938, the interest switched to the possible role of the virus in the causation of the various lesions in encephalitis. Studies to prevent JV were conducted, but no conclusive evidence was found because of World War II. In 1948 and other following years, more outbreaks had occurred, and so had more studies, but little to no info came out of them. Now that you're aware of JV, I hope that if you travel to Asia or Australia, you frickin' get vaccinated and don't have your brain swollen.
Vaccinated. Yeah.